All right. Thank you everybody for joining us for this amazing physiotherapy webinar. Amazing physiotherapy webinar. Thank you for your time. Thank you. Okay. Welcome you all for this great lecture of today. we are going to be talking on knee osteoarthritis, but before we go into that, we would like to introduce what osteoarthritis is all about. Osteoarthritis is a degenerative changes. All right. Okay, let's keep on joining as we wait for, I think our time remains 5 more minutes. Okay, let's wait for others to join us. All right. Thank you all for your time. Okay. As you are waiting, when you are joining, inform your friends to join this great webinar today. Inform them because this will be an eye-opening to broaden our horizon on all about osteoarthritis. So, because some of us might have been wondering, what will they do? How are they going to be able to get rid of this pain that have been troubling them all over the years? So, we try as much as we can to be able to enlighten or give you a solution to the pain and how you will be get ready for it. Join and inform your friends. It's almost time. We have less than 3 minutes to commence the webinar. All right. So before that time, I would like to briefly introduce myself. I'm Dr. Goodluck Chibike from Amazing Physiotherapy Clinic. This is one of the best clinics you can find in Nigeria that will give you what you want all about a physiotherapist. All right. So we always take care of our patients like as we take care of ourselves. Not just to be able to collect money from them and go. No, we focus more on your health, unlike that of your money. So, all right. Thank you for your time. Thank you for joining us. 2 minutes to commence the webinar. Please, let's keep on joining. Let's keep on joining. Let's keep on joining. Okay. Let's keep on joining. Let's keep on joining. All right. Okay. In less than 1 minute, we'll commence the webinar. So I will appreciate your audience. I appreciate your question after this webinar. It shows that you are following, and also we can be able to provide you for that question you have been asking yourself, which you have not gotten the answer so far. All right. Okay. Some few seconds to go. Let's keep on joining. Thank you for your time, and thank you for joining us. For our colleague here, okay, I think it's time. It's already 11 a.m. So we are commencing the webinar at this point. All right. As we all know now, the topic of the day, what we are presenting to you today, is all about knee osteoarthritis. Before we go into knee osteoarthritis, I'll just try to briefly explain what osteoarthritis is all about. Osteoarthritis is a degenerative change that causes the deterioration of the articular cartilage, leading to erosion, tearing and wearing away of the articular cartilage, and which can now lead to pain, inflammation, limited range of motion at the particular joint which this osteoarthritis affected. So let's move properly to our topic of the day, which is knee osteoarthritis. Knee osteoarthritis is a degenerative joint disease. So if you look at my screen, you can appreciate the normal knee and the affected knee. The knee that is affected with osteoarthritis, you see the roughly surface of it, and this is what occurs when we are suffering with osteoarthritis. So at this point, you notice that the articular cartilage have already degenerated, that is growing osteophytes, change of the ligamentous stability, and every other thing have happened when this osteoarthritis started. All right. Okay, let's quickly move down to the introduction. Knee osteoarthritis is also known as degenerative joint disease. It is typically as a result of wear and tear and progressive loss of function in a joint. All right. So it's most commonly in elderly people, unlike the younger adults. Osteoarthritis is a painful chronic disorder that affects not only the knee, but also includes other joints like your hip, the spine, and also the hands can also be affected. The intensity of these symptoms increases or depends on individuals. It varies within individuals. So, and also progress slowly. All right. We have two major types of osteoarthritis. One is primary osteoarthritis, and two is the secondary osteoarthritis. Osteoarthritis of the knee that we classify as primary osteoarthritis is that degenerative changes at the knee that occur as a result of non-known cause. That is, there is no any attribute, there's nothing that we can just say this is the cause of the osteoarthritis apart from aging. So when you notice that when people start aging, they start developing some pains at the joint, which is a result of degenerative changes. So this primary osteoarthritis occurs as a result of aging, while the secondary type of osteoarthritis is the osteoarthritis that occurs as a result of secondary injury, that is trauma or any other type of injury that was not properly managed. So when you have injury at the joint and it was not properly managed, after some period of time, you start developing pain, stiffness, and also tenderness at the joint that was affected. But if these have already been properly managed, you will not develop osteoarthritis because of this pain. So that is why we meant to be able to visit a physiotherapist when we have any injury, especially at our knee or any other part of the joint, so that we get away from this knee osteoarthritis. All right. So secondary osteoarthritis occurs as a result of trauma or any other type of injury at the joint. Symptoms of knee osteoarthritis. Knee pain that is of gradually onset and increase or worsen with activities. You notice that sometimes people will start feeling some mild pain at the knee, and when you walk or you run for a long period of time, you now start having increase in that, or intensity of the pain will now start increasing. So this is a sign of osteoarthritis. You have to visit your doctor and make sure that you were properly diagnosed and checked, and also manage when it is starting moving. The second symptom is knee stiffness and swelling. Knee stiffness can normally occur when you start developing new osteoarthritis, especially in the morning. So we call it early morning stiffness. Early morning stiffness is one of the symptoms of osteoarthritis of the knee. Then we have swelling. Swelling is another type of symptoms of osteoarthritis. You notice that the knee joint starts increasing in size, and also there is pain, tenderness, and other sort of limited range of motion at that joint. This is another symptom of osteoarthritis, which will signal you to visit your doctor or physiotherapist for proper diagnosis. Pain after prolonged sitting or resting. Even when you are sitting in the office, when you are resting on your bed, you keep on feeling pains. So this is another symptom of osteoarthritis. Cryptus, which we call cracking sound around the joint or during movement. When you move, when you bend and stretch the joint, you notice that the cracking sound around the joint. This is another symptom of osteoarthritis. So, pathological process. Disruption in equilibrium. This results in cracking and fissuring of the articular cartilage, which leads to erosion of the articular surface. Cartilage that has been damaged cannot be recovered. That is one thing we should start early to manage this osteoarthritis, because once the cartilage is damaged, it cannot be recovered back. So if we start as early as possible, when we started noticing the sign, the cartilage have not yet damaged, but it's only the pain that we are feeling at the moment, which can be managed and we get rid of that pain. The cartilage, we keep on what? We continue to wear away as far as you are not treating it. So the cartilage keep on wearing away because aging is also coming up. So both aging and also trauma that have happened that may have been the cause of this pain, both of it will now keep on damaging the articular cartilage. Once the articular cartilage wears away, you notice that the bone surface will start being affected. So there will be bone-to-bone friction. So the bone-to-bone friction will lead to growing osteophyte around the bones. That growing osteophyte will lead to a limited range of motion around the joint, leading to occlusion of that particular joint. The bone surface will expand and osteophyte will grow or will start developing. All right, epidemiology of this knee osteoarthritis. Osteoarthritis is most commonly in what? It's most common disease in knee joint. The most common disease of the joints worldwide. All right. When with the knee being the most commonly affected, so in all the joints of the human body, the knee is commonly affected by osteoarthritis. That is what research have shown. So it's it mainly affects people of above age of 45 and elderly. So people, once you cross age of 45, most especially women, once you cross age of 45, you start developing knee osteoarthritis. And this continue to grow, and the symptom we now need to pain and loss of function. So we now notice that you cannot do everything you do with your knee before. You cannot bend, you cannot stretch it very well, and you cannot perform your activities perfectly. But not everyone with radiological finding of knee osteoarthritis are asymptomatic. What I mean is that it's symptomatic. What I mean is that when you went for radiological diagnosis center, so because of this nature, you may just wake up and say, let me go and check and know whether I have knee osteoarthritis. That's why that you are not having pain. So when you went there and they say, oh, Mama, Papa, you have knee osteoarthritis, and you are not having pain, you are not having stiffness, you are not having swelling, none of these symptoms have been manifested. So just note that this is a sign that I've noticed that osteoarthritis is about to occur in a few months or few years coming. So you have to start managing it earlier. And the research has shown that only 15% of people diagnosed with osteoarthritis are symptomatic. So this is one of the reasons why we have to also be checking ourselves even before the pain. Osteoarthritis of the knee affects nearly 6% of all adults. Like adults of about 6% was affected with knee osteoarthritis worldwide. Women was commonly affected, unlike the men. So the reason is that women have this kind of change in hormone when they cross the age of 45 to 50 years because of menopause changes, postmenopause changes. Roughly 30% of women and 10% of men were diagnosed with osteoarthritis above the age of 60 years with symptomatic. Among those older than 70 years, and 40% of them show the symptom of osteoarthritis. Prevalence of osteoarthritis keep on increasing as far as your age continue to increase, and also obesity rises. So obesity is another type of thing that can also lead us to this kind of issue. Because once we are aging and we are obese, automatically we are going to be what? We are welcoming osteoarthritis faster. All right. Etiology of osteoarthritis. This etiology focuses more of the secondary osteoarthritis. The secondary osteoarthritis we mean is the one that happens as a result of injury. That's a previous injury that have happened that was not properly managed. That is what this etiology is focusing on, because the primary osteoarthritis have already let us know that it's as a result of non cause. So it only occurs as a result of aging. When someone starts aging, degenerative changes start occurring, and osteoarthritis will now develop. So etiology, one is the obesity. Like I previously said about this obesity. Obesity is one of the causes of osteoarthritis because that will be overload. When somebody is overweight and your BMI is very high, so automatically you are overloading the joint. The articular surface is being overloaded, and there will be a degeneration of the articular surface, which will now lead to osteoarthritis. Joint hypermobility or joint instability is one of the causes of osteoarthritis. Because of the wobbling of the joint, we will hesitate the degeneration of the articular surface. All right. Malpositioning of the joint. Malpositioning of the joint, I mean, is the patient with all this thing we call the bone buckle, like genivalus or genivalus in the medical term. So when you have bone leg or care leg, it is quite obvious that you are going to develop knee osteoarthritis even at the below age of the what, 45. Even people at age of 35, 30 can develop knee osteoarthritis as far as you have this deformity of bone leg, care leg, genivalus or genivalus. All right. Previous injury, like I previously said, when you have injury, you fall or you have a road traffic accident that affected the joint, and you just wake up and say nothing happened much, and this have to watch. You just move on with your daily activities. After some years, you started developing stiffness, pain, and tenderness around the joint. So, which we now need to osteoarthritis of that knee joint. Okay, congenital deformity is another type of another causes of osteoarthritis. All right. Then we have immobilization. Immobilization in the sense that if you have injury, for instance, you have fracture that is close to the knee joint, and the whole knee joint and the fractured area was casted in a cast. So then, over the period of time, like after 6 weeks or thereabout, you remove the cast, and the knee joint was not properly mobilized and managed very well. You notice that there will be an limitation in the range of motion, and also the knee joint will now start developing osteoarthritis. Family history. Some family have this history that osteoarthritis runs in their family, even at the elderly age or the younger adult age. So we have metabolic causes. Metabolic causes, example like hereditary disease, can also lead to osteoarthritis. All right. Let's move to the relevant anatomy. That is the structure. Let's see the proper structure of the knee. How the knee is supposed to look like when it is in its healthy physiological structure. The knee joint is a synovial joint that which consists of two articulations. The articulation I mean is the joint, two joints. The two joints that in the knee are one, is the tibiofemoral joint and the patellofemoral joint. The tibiofemoral joint is the joint that is the joint between the convexness of the femur and the concaveness of the tibia surface. While the patellofemoral joint is the joint between the patella and the what? Femur. All right. Any of these joints can be affected with knee osteoarthritis, but the patellofemoral joint can be commonly affected. All right. Okay, look at the structure of our normal knee. When the knee is at its healthy physiological structure, this is how the knee is supposed to look like. Very smooth, very clear, and nothing like a rough surface. So if you look at it, you see our patella by the left-hand side, you see our femur by the right-hand side, which is the bigger bone upward. The bigger bone downward is the tibia, while the other whitish, milk colorish soft tissue known as the what? The articular cartilage, or we have what we call the medial meniscus and the lateral meniscus. The rope-like structure, milkish in color, that connects the upper bone and the lower bone is what we call the ligaments. The ligaments that holds the bone also help in stabilizing the joint. So the one by the left-hand side is called the lateral collateral ligament, while the other one is the medial collateral ligament. If you look at the middle, you see a cross-like structure again like a rope, which is the anterior cruciate ligament and the posterior cruciate ligament. All right. Okay, as we have seen the normal structure, let's now correlate it with what we saw for the first page and see how dangerous this knee osteoarthritis looks like. Okay, pathological process. The process of osteoarthritis affects articular cartilage of the joint. Articular cartilage is in its normal equilibrium except when the osteoarthritis started to develop. So you now notice there is a disruption in what? In the collagen, which leads to a lot of elasticity of the articular surface. All right. Disruption in equilibrium results to cracking and fissuring of the what? Articular surface, which lead to erosion of the joint. Cartilage that have been damaged cannot be recovered. As I previously said, once you allow it to damage for a very long time, it cannot be recovered. That will bring another substitution means to be able to cushion and also stabilize the joint and get rid of the pain. Okay, but this cartilage that have been damaged will continue to wear away as far as the treatment is not ongoing. Bone surface will start being affected at the chronic phase. That is at the grade 4 osteoarthritis. Bone surface will start to expand and spot, or what we call osteophyte. A growing small bone will start to develop around the knee joint. During this period, we now notice that even the ligaments will get enlarged and also the what? Muscle get atrophied because of poor use or disuse. This thing will start causing more deformity at the knee. And if the person doesn't even have cane leg before, which we call genivalus or genivalus, the person will automatically start developing genivalus and genivalus because of the total degeneration of the articular surface. All right. Okay, signs of osteoarthritis, knee osteoarthritis. Pain upon movement. When you move your knee, you notice there is very severe pain at the knee. Stiffness, like I previously said, stiffness at the joint is one of the signs of what? Knee osteoarthritis. When you wake up in the morning, you find it difficult to move your knee or to straighten it or bend it, except when you start gradually moving and straightening, and you get rid of the pain, you can be able to get up and walk and move to your activities of daily living. Loss of range of motion. So you notice that your knee cannot fully bend or straight as it is supposed to be before. So that is what we call limited range of motion. Pain after prolonged sitting or lying down. Even when you sit to rest for a very long time, even when you lie down, there will still be pain. So you become restless when you develop this knee osteoarthritis and leave it for a very long period of time. Pain on the joint 9 palpation. When you press around the joint area, you notice there is one very severe pain or tender pain around the joint 9, especially your knee joint. Joint enlargement, the joint will swell and increase in size, unlike the contralateral side. When you look at the second one, you notice that the other one is very obvious increase in size. All right. We move to diagnosis. How can we diagnose a patient that has this knee osteoarthritis, or how will you, as a person at home, notice that this may be as osteoarthritis that is disturbing you? This may be a sign, or this may not be a sign. Okay, I would advise you that the proper diagnosis has to be done in the clinic and also be confirmed. We have to be done within the physiotherapy clinic and confirmed using what? X-ray. So you meet your doctor, you complain, and the doctor will clinically diagnose you. And also, if there is any need, we now refer to the neurological department for proper confirmation of the name issue. So now, the osteoarthritis is subdivided into 5 grades. One, we have grade 0, grade 1, grade 2, grade 3, and grade 4. This is how severity the knee osteoarthritis is. So this grade depends on the severity. So 1, grade 0 is the normal structure of the knee osteoarthritis, as we have properly said, or as I have demonstrated before showing in my screen, the normal structure of knee osteoarthritis. So of the knee, normal structure of the knee. Then when the osteoarthritis started developing, we come to grade 1. The grade 1 is when it is what? It is not symptomatic. So you are not going to see any symptom, rather than you are just diagnosed with osteoarthritis because you visited the neurology department and they assess and check and say you have mild osteoarthritis. That is grade 1. No pain, no limited range of motion, or no any no anything limiting in your daily activities. You doesn't feel any pain. You doesn't feel any reduce or inflammation, tenderness, or all about. So that is grade 1. Grade 2 is when you started feeling mild pain, and also there is what? Mild growing osteophyte around the joints when examined under X-ray. So then, and there will be a mild reduction in what? Joint space, showing the degeneration have started at that moment. So for the grade 3 is when there is a moderate degeneration of the articular surface, and also there is a moderate or obvious growing osteophyte around the joint, and also there is pain and mild limited range of motion at that grade 3. Grade 4 is the severe case. The severe case that almost almost all the articular surface have already been totally degenerated, and there is a very big frictions, bone-to-bone friction at the joint, crepitation, limited range of motion, swelling, redness, and also change in temperature around the joint will occur. All right, let's move to the treatment. The treatment of knee osteoarthritis consists of two different types. One is conservative management, and the second one is the surgical management. But the conservative management is the best management you can do, because surgical management cannot even end up the pain. Rather, after the surgery, you still come back to physiotherapy for proper management or proper follow-up or further treatment. All right. Then, the main focus of this knee osteoarthritis management is one, promoting the self-management, re-educating, reducing pain, optimizing function, modifying the disease process, and also its effects. That is the main focus at this point. Okay, let's move to the conservative management, which is our major focus of the day. The conservative management, the primary treatment of knee osteoarthritis is conservatively is what? Exercise therapy within physiotherapy. So this exercise therapy is going to be exercise done with supervision under a professional that is monitoring you, prescribing it, and tell how many times and when and where to do it. That is what we mean by exercise therapy within physiotherapy, not on your own, not going at the gym and do what gym instructor told you, or jumping around the street and say you are doing exercise. They say that exercise can reduce knee pain. No, there is type of exercise we do. We used to also reduce this knee pain. One, patient education and exercise therapy is the key for this point. Okay, first of all, when you visit a physiotherapist will educate you, tell you on what to do, what is aggravating your pain, so that you can avoid it. If it's your weight, if it's your patient, if it is your posture, we educate you on that. Because even if we treat you finish and there is no education on what have initiated the pain, for you to be able to avoid those things that have initiated the pain, if we didn't educate you on that, you go back to that same posture, to that same activities that have caused the knee osteoarthritis, automatically the treatment will not work. That's why education is very important. And then exercise therapy, especially aerobic exercises, that is a no impact aerobic exercises is very, very important. So this point, activities modification is very, very okay. So we check the activities you are doing. Some of the activities that can aggravate the knee pain, we advise you to stop it, and also to proceed with the one that can help you to get rid of the pain. Advice on weight loss. Weight is a very major, let me say, factor for knee osteoarthritis. If you are overweight or obese, automatically you are going to develop knee osteoarthritis as early as 30 years or 35. Before 45 years, you have already started having knee osteoarthritis. So weight reduction is very, very important in this kind of condition, because now, if you are overloading the joint and the joint is already degenerating, so automatically you are giving yourself free tickets to what? To grade 4 only osteoarthritis. Before you know it, everything will be totally degenerated. Then how do you lose your weight? You lose your weight by consulting two professionals, the dietitian and the physiotherapist. Dietitian will prescribe your nutrition, while the physiotherapist will prescribe the more impact aerobic exercises that will help in tackling those your pain and strengthening the muscle mobility and flexibility of the joint. All right. Then we move to knee brace. Knee brace is very good in knee osteoarthritis, but it doesn't perform. It doesn't substitute, or it doesn't start at the place of treatment. So when you are wearing knee brace, it doesn't prevent you from receiving your treatment. Knee brace is like let me say, is an additional treatment after you have done the other treatment. So knee brace is only good in a condition where we need a weight transferring process, like patients with genovarus and genovalgus. So this patient with genovarus and genovalgus, you notice that there will be a force concentration at the medial or lateral part. In the case of genovarus, we notice that there will be a lot of weight concentrating at the medial aspect of the meniscus, which will now hesitate the damage of the medial meniscus. Then in a patient with cane leg, that is genovarus, the valgus, then there will be a weight concentration at the lateral part, which will now need to what? Hesitate the degeneration of the lateral meniscus and now lead to knee osteoarthritis. All right. Okay. We now use knee brace, especially the type of weight transferring knee brace, or I think this type of knee brace is very, 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 very important. So this is the best knee brace we can use. This is AutoFit, a weight transferring type of knee brace. All right, we use it in order to now align and transfer the weight that is concentrating at the lateral part of the knee. Then it will now move to the medial and also the what? Central part of that knee that have not been damaged. Then the articular cartilage that remains at the medial and central part will now help in cushioning the joint and prevent direct bone-to-bone friction, and the pain will get relief. All right, we now move to our exercise. We demonstrate some of the exercises that can help you to do this, to get rid of this pain. So, Dr. Mitchell, come around. Let's show some demonstration. Okay. Then the first exercise we are going to do is the first exercise we are going to do is the bicycle ergometer. The bicycle ergometer is very, very good in knee osteoarthritis. So just let me show you one thing. Just look at me. This is bicycle ergometer that I'm talking about. So riding the bicycle ergometer is very, very good in knee osteoarthritis. It helps to strengthen the quadricep and also the mobility of the knee joints, especially when there is a weakness or atrophy of the joint. So the second exercise we are going to do is what we call the long sitting calf stretch. Long sitting calf stretch is an exercise we use towel to perform. So we put the towel under our foot and we sustain and press it very static and hold for 15 seconds and relax. Hold for 15 seconds and relax. So when we do this, you notice that we are strengthening the quadriceps and also increasing the muscle bulk. Okay, this exercise is very, very much important for a patient with knee osteoarthritis. All right, we'll be moving on to the third exercise. Okay, the third exercise is the one we still use the towel. This is called the towel-assisted knee mobility. Towel-assisted knee mobility is when you use the towel, drag the knee, bend it, especially in the grade 3 and grade 4 of knee osteoarthritis, when the range of motion has been limited. You use it to assist and bend the knee and also push and stretch it to also strengthen the muscle. Do this for 10 to 15 times and move to the next exercise. All right? Okay. The next one is the short arc quadriceps exercise. The short arc quadriceps exercise is also performed with the towel. You roll a towel and put it under your knee and compress it very well. Take your foot down to the bed. Dorsiflex, plantar flex. That is what I mean is take your ankle upward and downward and raise your knee again. Take it down to the bed. Dorsiflex, plantar flex. Take it up again. Take your ankle on your foot on the bed. Dorsiflex, plantar flex, and take it up again. Repeat this for 10 to 15 times and move down to the next exercise. All right. The next exercise is the breathing exercise. Breathing exercise grade 1. Because we have different grading of breathing exercise. Breathing exercise grade 1 is also used to manage knee osteoarthritis. In grade 1, you lie on the bed and bend your knee to angle 60 to 70 degrees. Then relax your hand by the side and lift your waist up, bring it down. Lift your weight up, bring it down. Lift it up, bring it down. Repeat it from 10 to 15 times and move down to the next exercise. Okay. Then the last one is the prone knee bending. The prone knee bending is performed in what? Prone lying. You lie with your tummy facing down and relax your hands. Then the affected leg, you bend the affected leg, you stretch it. You bend the affected leg, you stretch it. You bend the affected leg, you stretch it. Perform this 10 to 15 times and move to the next exercise. Okay. The next exercise is what we call the sit hamstring stretch. Sit hamstring stretch, you are going to sit on the bed, on the chair like this. All right? Put the affected leg forward. When you put the affected leg forward, you now put your right hand on the tummy. Then put your left hand on the bed to stabilize yourself. Lay your weight on the affected leg and stay for 15 seconds. Relax. Lay your weight on the affected leg and stay for 15 seconds and relax. Lay your weight on the affected leg and stay for 15 seconds and relax. Repeat this for 10 to 15 times and you move to the next exercise. All right. Okay. The next exercise is the medial quadriceps mini lunge. The medial quadriceps mini lunge is the one we perform in standing. So you stand, the medial quadriceps mini lunge, you will stand, then bring the affected leg forward, put the contralateral hand by the medial part, very good. Put it by the medial part, yes, then put the other hand on your waist, and then lay your weight on the affected leg, move it forward and take it backward. Move it forward and take it backward. You are transferring the weight on the affected leg and strengthening the quadriceps at the same time. This will increase the muscle work and also strengthen the muscle and improve in the range of motion at the same time. All right. Okay. The last one is the best inner range pulse. The best inner range pulse is the one we do with vestibular ball. You go against the wall, bring vestibular ball, put at the back of the affected leg at the knee side. Nobody is putting this thing. Put it at the affected side and compress it, relax. Compress it, relax. Compress it, relax. Repeat this for up to 10 to 15 times and move to the next exercise. All right? Okay. The next exercise is the self squat. The self squat, we do the self squat with chair. So the self squat is the one we perform using chair. Why we call it self squat is that you have to perform a type of squatting that will help to relieve you from the knee pain, not the other type of squatting we do in the gym that damages our ligaments and increase knee pain. So the self squat, you keep a chair behind you, then you make a line in front of your two toes, and also make sure that your knee will not cross the line as you are squatting, and your hand will stretch forward. Then you will notice that your center of gravity will be going backward, so that like trying to fall backward, and this chair is performing the safe aspect of it, so that if you mistakenly fall backward, you can sit on the chair. But that is the proper squatting. Then you go down like this, you get up. You go down like this, you get up. Because squatting should not be below 90 degrees, it will be 60 to 70 degree angle. All right, that is what we call safe squatting in the management of knee osteoarthritis. All right, the next one is the double heel raise. The double heel raise, we also use chair to perform the double heel raise. So you go to the back of the chair and hold your hands on the back of the chair. Then lift your two heels together and bring it down. Lift your two heels together and bring it down. Lift your two heels together and bring it down. Perform this 10 to 15 times and move to the next exercise. All right. The last treatment is going to be the orthotic device. The orthotic device, I mean, is the knee brace. Like I previously said, that knee brace doesn't substitute your treatment, but it does anchoring it. So after your treatment, you can use this just for a subordinate. So knee brace, especially the weight transferring type of knee brace, is very good in knee osteoarthritis, especially patients that have genu valgus and genu valgus, that is K-leg and bone leg. This knee type of knee brace is very, very good. If you look at it, there is two hinges at the sides which help in stabilizing the joint and transferring the weight. If the weight is more of the lateral, it will help to transfer the weight from lateral to medial and central part of the knee, which has a healthy articular cartilage that have not been degenerated. All right. The next treatment is the acupuncture. Acupuncture is very, very good in knee osteoarthritis. I can proudly say that up to 80% of the patients with grade 3 knee osteoarthritis are managed with acupuncture receive their optimal health. All right. In conclusion, we are going to tell you today that your take home is education and exercise therapy within physiotherapy is the key. So you receiving your treatment within physiotherapy sector is the major part of the treatment of knee osteoarthritis, not the one you go to the gym or run around by yourself. Okay, all right. Thank you for listening and thank you for joining us. Thank you for your time. We really appreciate you all for following up in this webinar. We'll be waiting for your contribution and questions. Okay. Thank you, everyone. Dr. Chantel, I welcome you. Dr. Chantel, you are welcome for this amazing webinar. Okay. Welcome you all, the doctors in the house and some of our colleagues, the patients and other people that join us to be able to get some enlightenment in this lecture. All right. Okay, I'll be listening for your questions. Let me take some questions here. Okay. All right. Calcium tape is very good for pain management, but it cannot manage osteoarthritis and cure the pain. Because what happens in osteoarthritis is not only the pain, but also there is the degenerative changes, muscle weakness due to disuse. If you use calcium tape cannot strengthen the already weakened muscle or regenerate the already degenerated cartilage. So I will advise you. So you can still use calcium tape to manage pain, but I advise you that the proper management you will use for this knee osteoarthritis is strengthening exercises, acupuncture, and other aerobic exercises that can also help in strengthening the muscle and the ligament, and also keeping the joints physically fit. Okay. I think we have answered your question. Yeah. All right. The main risk factor for developing knee osteoarthritis, like I mentioned earlier, I talked about your weight. I talk about the age. I talk about what? Previous injury or trauma. That are the major risk factors. If you have a trauma, any injury at the joints that was not properly managed, automatically you are looking ahead of having osteoarthritis in a few months or few years. All right, then if you are overweight, you can develop knee osteoarthritis within a few years. Let me say from between 35-40 years, you can come down with knee osteoarthritis because of your weight. Because of abnormal transition of the weight across the joints, we now lead to degeneration of the knee articular cartilage. All right. So that are the three major risk factors. Your weight, aging. Aging is inevitable. You cannot stop aging. Aging is something that everyone can pass through. Whether you are overweight, underweight, or normal weight, and you are aging, as far as you are aging, you can still develop knee osteoarthritis. Everybody can develop knee osteoarthritis, but your weight can also make your own knee osteoarthritis to come earlier than it's supposed to be. So weight, injury, and your age is the major risk factor. I think I've answered your question.
Good morning, Doctor. Good luck.
All right. Good morning, Dr. Chantel. Happy to hear
Okay,
from you.
you're welcome. Okay, I have this 14 years old child that came into the clinic with the mother. So she had a fall 2 years when she was 10 years old. So currently she's having knee pain. I want to ask, is ultrasound therapy advisable for a child?
She had which name?
She has pain on the anterior knee. So I'm asking, can ultrasound therapy be used for the child or is not advisable for children?
Okay. One, no matter how excellent ultrasound can perform in managing pain, we don't advise people to use ultrasound in children that still growing because of that still growing bone plate. So we will remove ultrasound from the treatment plan. It is not advisable. Thank you. Okay, any other question?
I have another question. Thank you. A patient came in with knee pain. She's 45 years old, female. She said that she has done physiotherapy in the past concerning her knee, but recently the pain started again. So when she went for MRI, she discovered she has a Baker cyst at the back of the knee. What could now be the cause of the pain? Because she's seriously having severe pain on the bilateral knee, but the Baker cyst is only on one knee. So what could be the cause of the pain?
Okay, one, like possibly somebody can have a two different condition at the same time, even at the same period, that will now look like is as a lot of one thing. So there's no way that knee osteoarthritis can lead to Baker cyst or thereabouts. No. So the osteoarthritis occur. Okay, now we have already mentioned that is a woman. One is a woman that has the pain, right? Then secondly is over age of 45 years. Like in my research, as I previously showed, that anybody, apart from both men and women that above age of 45 can develop knee osteoarthritis. And secondly, you have to look at the woman's weight. If the woman is obese or overweight, that means two different things is happening. Then the woman's age have reached up to 45, the woman has weight, and this will automatically lead to knee osteoarthritis. Then another thing I want you to also consider to monitor in that patient is whether this patient has genivalus or genivalus. If this patient has genivalus or genivalus, he or she can also develop knee pain from the age of 20 years and above, say, so as early as possible. So the knee osteoarthritis occur on its own, while other issue occur on its own. Thank you.
Thank you very much, Dr. Goodluck. But I want to send in another question. You mentioned the use of bicycle ergometer in management of knee osteoarthritis. Please, is it advisable for you to put a patient that is severe pain on bicycle ergometer?
Okay, thank you very much. Your question is very, very perfect. I forgot to mention it earlier. When you are using bicycle ergometer to manage patients with knee osteoarthritis, it's not all patients with knee osteoarthritis you just tell them to jump into bicycle ergometer. So it's not good for all the whole patients. Our treatment is based on patient specific. So consider the patient's age. One, consider the grade of the knee osteoarthritis. If it is already for grade 4 of knee osteoarthritis, this patient cannot even ride the bicycle. So automatically, if you force this patient to ride the bicycle, the patient will end up developing more pain. So the bicycle ergometer is advisable, especially in grade 1, grade 2, and also in between grade 2, grade 3. So, but most effective in grade 1 and grade 2 knee osteoarthritis. It will help to stop the progress of the degeneration and also strengthen the muscle of the knee, that is the quadriceps and other soft tissue around the knee, and prevents that degeneration from progressing. That is what bicycle ergometer helps. help in managing that pain. Thank you.
Thank you very much. I still want to throw in a question as well. All
I
right.
enjoy the question, ma'am.
You mentioned the use of knee support. Okay, would you advise a patient to make use of knee support without proper physiotherapy management?
Okay, thank you very much. I even said it, I briefly said it when I was presenting earlier. I said that orthotic device like this knee brace, there's different type of knee brace. We have a type of knee brace that is of a weight transferring type. The weight transferring type, I mean, is the knee brace that can help in weight transfer and stability of the knee joint, not other soft brace that people might still wear as knee brace. It's a different type. So this knee brace is okay when a patient has knee pain as a result of genovarus or genovarus. But even this patient that have genovarus and genovarus, you will use this to transfer the weight from the lateral side to the medial side that have not been degenerated. Yes, fine and good. So, but transferring the weight is not good, is not the end of the treatment. The patient must receive accurate physiotherapy management and use knee brace as what? Additional management while moving around and while going for his or her daily activities. It is only used when you are active, not when you are at rest. So knee brace is advisable to use based on doctor's prescription, not go to market and buy it, because we the physiotherapists will tell you when to use it, where to use it, and when to remove it, and the side effects and the benefits of that knee brace. Thank you.
Okay. One more question, Dr. Goodluck. All right, I have he's a footballer, a patient. Last year, he walked into my clinic. He has pain on the posterior knee. Then after 1 week again, he said that he developed he noticed that his knee when during movement is making a popping sound. What could be the result of this?
Okay, can you recap
He's
your
an
question?
athlete.
Recap your question.
Okay, I said that a patient walked into my clinic last year. He's an athlete. He said that he's having pain on the posterior knee. But
Huh?
after 1 week, he didn't go for treatment. After 1 week, he started noticing that during movement, he hears a popping sound on his knee. So what could be the issue?
Okay, thank you
How
very
I don't know
much.
how to put it. What could be the
Yeah,
problem?
I understand what you said. Thank you very much. What it means is that, let me now go back to another risk factor, which we touched, but maybe you didn't pick it up. So you know that athletes has high risk factor of developing knee arthritis because of the frequent use or overuse of the joint and frequent twisting of the knee during all this striking and other form of movement during the activities of football or whatever, whether volleyball or football or anything that involves race. So they have high risk of developing knee arthritis because when they frequently twist, it's like a trauma, a micro trauma occurring inside the joint. Just a small trauma you may not notice. Sometimes they will not feel that pain, but after some days they feel small pain and the pain will go away. They continue their activities. So that frequently twisting at the football field may lead to ligament laxity. Ligament laxity, what I mean is the ligament will start being what? Weak. The ligament will relax and the knee will become what? Unstable. The knee will start moving in the abnormal movement. That is why you are not hearing any this is a purple sound. So if you ask the patient very well, the patient will tell you that I feel like that's my knee will dislocate or go out of the place sometimes. So this shows that this patient automatically has an injury or a laxity at the ligament of the knee. Whether when you do the test of the knee, you have to check the anterior, posterior, lateral, and medial collateral ligament stability using anterior drawer test, posterior drawer test, varus and varus test. So this will now give you more guide on how to note which ligament is affected in this patient. Thank you.
Thank you very much, Dr. Goodluck. This is my last question. Please, how do you differentiate a patient with meniscal injury from ligamentous injury of the knee? Thank you very much. This is the last
one. Between patients with ligamentous injury and patients with meniscal injury, right?
Yes, yes, thank you.
Like as we previously said, meniscal injury will occur as a result of degeneration. It must not be as a result of trauma. It must not be as a result of aging alone. Two things occur when somebody has meniscal injury. Trauma and aging can lead to it, but ligament injury occur as a result, mostly occur as a result of trauma, especially repetitive trauma at the knee joint. When you have a repetitive trauma, that is either subluxation or dislocation frequently at the knee, it will end up having what we call the have a strain at the ligament. You strain the ligament and the ligament becomes elapsed. When the ligament becomes elapsed, we now say that you will now feel severe pain when you come, we say you have a ligamentous injury. So that is ligamentous injury can occur as a result of strain, while the meniscus injury can occur as a result of overweight, aging, and also trauma can lead to that. Thank you very much. Okay.
How can lifestyle change impact the progression and management?
Can you come again?
How can lifestyle change impact the progression and management?
Okay, lifestyle modification is very, very important in preventing the progress of osteoarthritis of the knee, because one, when we measure lifestyle, some people lifestyle is more of race, football, and also some people's lifestyle is more of jumping, jogging, and other things. So like we say that high impact exercise can affect the articular cartilage. Right. Okay. Now, if you are now a type that also eats more, you eat too much, you are overweight, and you like jumping and running. So the overweight and also the high impact exercise you are doing can lead to degeneration of that articular cartilage. Do you know why? The reason is that the structure of the knee was conditioned in a way that it has a specific node. It will be capable to carry. When you overload it, it will end up generating the cushioning effect, which is the articular cartilage. So then you jumping frequently is like also overloading it. So if you notice that you have knee osteoarthritis and you are somebody that does more of jumping or running, we are going to advise you to avoid anything that involves landing effects. Anything that involves landing effects can also increase your pain when you have knee osteoarthritis. Rather, you do more of flexibility, static contraction, and also isometric contraction exercises, which is isometric contraction exercise, which will help to strengthen the muscle around the knee and stabilize the knee joints. This will now help to reduce or to prevent the progression of that knee osteoarthritis. Thank you. I think we have tackled all of our questions for now. I think our question, this is the last question we can see. All right, or do we have another question? Let's check very well and know whether we have another question. Any other question? Okay, I think this is the last question we have in the message in the question session. Okay. All right. We thank you all for joining us today. We thank you all, especially Dr. Chantel. I really enjoyed our conversation today, and I enjoy your questions. Your question is very, very interesting. Thank you all for your time, and see you next time in our next webinar. All right? Okay, we'll be ending the webinar at this point. Goodbye and remain blessed. Regards to everyone.
Hello? 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 Hello?